it's me, Dr. Allison here again, and today I'm going to be talking about the common challenges with breastfeeding. So here we go. There's a lot of challenges, so I'm going to try to hit the most common ones. Yeah, so I got some notes here, so if you see me looking to the side, that's what I'm looking at. So one of the first common challenges is breastfeeding in public. A lot of people don't want to do it. They don't know how to do it without being uncovered or being uncomfortable. But that's a big challenge that turns a lot of people off from breastfeeding, which I totally understand. It's hard to kind of get used to, or how to figure out, how you can do it and what clothes work best for you and how your baby feeds, and if your baby is used to like the nursing covers and things like that, and how you're adjusting, and how easily you've become with just breastfeeding and clothes and maneuvering, all of that stuff. At first it takes a little while to get used to it, get the hang of it, but one thing that I would say is either let's say you're at a restaurant. Well, now we're not really at restaurants, but if you're somewhere, where there's a lot of people around, you can either find like a corner. If you were in a restaurant, you can find like that corner booth, and breastfeed there, kind of turn to the corner. If you're out at a park, there's always a tree or something like that where you can kind of like have your back and then still turn and talk to your friend or whoever, if that makes you more comfortable. There's all kinds of new clothes that are coming out, like breastfeeding tank tops, different types of bras, shirts, dresses, and things like that, in addition to nursing covers. So search the market and ask around. There's a ton of different things that you can even just try, because what might work for one person, it may not be comfortable for you, or you don't like that particular one, but there's so many things out there, covers, that can help you just get used to breastfeeding in public. Another thing, now that I think about that, is just family is a challenge, because if your mom or your grandma or cousins and aunties, if they didn't breastfeed and now you're breastfeeding, now it's like a whole social thing, and they may be like, why are you doing that? Or you're still doing that, overcoming challenges of other people's opinions. So one thing, it's good to just be sure of why you're doing this. Like, why do you want to do this? Is this something you want to do, or somebody else making you do this? And be sure and grounded in your own, beliefs around breastfeeding. And that's why I'm sending out a lot of these videos, and being somebody that people can come and talk to, and just talk about, their fears and any challenges that they have. But yeah, family can be a big thing, and sometimes that plays culturally, because some cultures are not a breastfeeding pro culture, or even generations are not. So depending on that, yeah. In the US, even though breastfeeding is coming back a little bit, it's still pretty much a pro formula country, is what I've been reading about. It's still a pro formula country. They're trying to get breastfeeding initiatives in a lot of the hospitals, which I've seen is a little bit better, but yeah, so you might run into some of people's opinions. That's another challenge. Another challenge is pain. A lot of moms talk about how painful it is in the beginning, or a lot of people experience pain. And one thing that I always say is pain is an indication that something's not going right. Breastfeeding shouldn't be painful. In the beginning, it could be a little bit uncomfortable because you're not used to that sensation. Yeah, and you're just getting in the hang of the latch and the positionings and things like that. But it shouldn't be painful. So if it is painful, it's probably a latch issue. And if it's a latch issue, you can always detach the baby by putting, a clean finger in a corner of their mouth, and then just detaching that latch, and then repositioning them back on the breast. So it's probably a latch issue, a position issue, something like that. And if you've tried those things, you can always contact me or a certified lactation consultant, somebody that you know, or if it's not me, I can always recommend somebody to you. I always say take advantage of the lactation consultants in the hospital before you leave, just to help you get the hang of things, or if you have any questions, that person is there for you before you go home. Another thing is just positions, getting the hang of the different positions, and that could take some practice. Getting used to different positions, the football hold, or you're holding the baby like that, or the cradle hold across your body. So there's different positions that I actually might make a video about the different positions or post a picture. But that's something that can be, your baby may not like one position, or you may not like one position. So it's getting comfortable, the both of you getting, comfortable. What else? Oh, two more. Another one is that a lot of moms may be feeling like, I don't know if my baby is getting enough milk. Now, that is a huge challenge, because you may have a baby who just loves to eat and is just always nursing, or they're newborns, and newborns are always nursing. They nurse 8 to 12 times a day. So if it feels like they're eating a lot, they are, like they do in the beginning, and it will not always be like that. It will not always be like that at all. Like once you get around 6 months, 7 months, they feed a lot less, but in the beginning it is a lot. So don't let that deter you and like, why is this child eating so much? Like, that's what they do. The newborn stomachs are like size of a quarter, so they're only going to take in like an ounce or two at a time, less than that. So they're going to eat throughout the day. And breast milk does digest quickly, because you want it to be easy on their newborn stomachs and their newborn gut. So it does digest quicker than formula, but that doesn't mean that formula is necessarily better. And this, of course, is to never shame anyone who has to use formula, supplements with formula, or needs to use it in the future. But I am just bringing awareness to the differences. So newborns do feed a lot. So knowing if your baby is getting enough milk. So that definitely is going to go by how much they're weighing. We can do weighted feeds. You can check that when you go to your pediatrician on those visits. It's usually like 1 to 2 visits that first month, and then monthly after that, and then every other month. So checking that, and you can always go to like a breastfeeding center and just weigh your baby for free. So it's definitely going, but if your baby is losing a lot of weight, then something is going on. But babies do lose weight in the beginning, so that's not a good indication that your baby's not getting enough milk. There are other indications are, do your breasts feel softer after a feeding? Does your baby look satisfied? Things like that. So there are a lot of different factors that go into if your baby is getting enough milk, not just if they're feeding a lot. And then one last major challenge is clogged ducts. That is a major one. It happens to me. It happens to a lot of people. It's very common, but there is something to be done about it. So clogged ducts. So that you may feel like it's usually on one side, that one breast is very hard and painful and very engorged. So you will know if you have a clogged duct. It's not just, oh, this is a little bit painful. It's like, no, it's like, ow, this is really painful. It's hard. It's like a rock. So clogged duct, and the best way to get over a clogged duct is, to breastfeed. The baby is the best at getting the milk out and to unclog that duct. So I always say, definitely, you still have to feed on that side, which is still very, very painful, but that's the best way to get that milk out there and get that duct clear and to relieve that pain. So breastfeeding on that same side, both sides, but still breastfeed first on that side, then move to the other side. You can also massage your breast to try to hand express some milk. Also vibration. So let's say you have an electric toothbrush or something that vibrates, you can put it there, and that may just the vibration might just help unclog that duct a little bit. Yeah, so those are a few things, and wearing not tight bras. So if you can wear the loosest bra that you have, that would also be helpful. You don't want anything tight at that time, and that's going to help unclog that duct. Now, if you're having a fever, if you're feeling sick, you might have an infection called mastitis. So that's when you will need like a call to your doctor that you may need antibiotics. You may need further instruction from your doctor or something that can be prescribed to you. So that's what I say with that. And with both a clogged duct or mastitis, you still need to breastfeed. You still need to nurse on that side. You still need to clear that duct. You will not be hurting your baby. You're not going to pass any infections or sickness to your baby at all. So those are a lot of the common challenges. And I hope that just reviewing those, you can see that there is something to do about it. It's not, you don't have to give up. And there's ways to help get around those and get through those tough situations. So if you ever experience any of that, you can always message me, send me a message, email, and I can help you get through that. So yeah, I hope these helped. And yeah, I'll see you in another video. Bye.